than rubella. So rubella is the German measles, okay? And then the regular measles, or rubeola, okay? That's an airborne. So we're not going to talk about that right this second. Now, as part of the other part of the MMR is mumps, right? And we don't see mumps very often anymore because of vaccines. We are seeing a bit of an influx in these types of things because of groups that don't believe in vaccination anymore. Okay, then we also have our other M. This one causes severe neck pain, the nuchal rigidity, high fevers, and it could be bacterial or viral, and you hope and pray that it is not bacterial because your patient will be dead within a day. Okay, so most of the meningitis patients come in and it's usually viral, okay? And then the other, mycoplasma, can cause pneumonia as well. Okay, so then our A, what's the only thing left? Well, we gotta throw this guy in because it's an A. Adenovirus. That's just another virus that causes the common cold, right? And as will be explained in your fun little COVID game, the COVID is another coronavirus, right? And there are a gajillion types of coronaviruses that usually only cause the common cold. However, there's lots of different coronaviruses, and the very incredibly intense and virulent ones that cause severe illness are the COVID and then SARS and MERS. And they'll go over that in the little game. Okay, so then we have adenovirus, and then we got to finish it out with an N. So we're going to do the novel COVID. Okay, now, wait a minute. They have found that the novel COVID can become airborne. And by further extension, any of these respiratory infectious diseases that are droplet could technically become airborne if you're doing something. And that one type, there's two main treatments that could potentially, well, definitely cause the virus or the causative agent to become airborne or aerosolized. So could you think of a treatment that we do in the ER all the time for cough, difficulty breathing, asthma exacerbations, COPD patients? Bronchodilator, right? So I hope you're thinking of a word that starts with an N, nebulizer. So if we do a neb treatment on a patient, if you've seen a nebulizer, there's a little, what I tell the kids when they get a nebulizer treatment is I tell them there's a choo-choo train and it's puffing out the smoke, right? Well, that bit that's puffing the smoke is puffing it out into the room. And so if you don't have correct precautions, you can't have the patient do a nebulizer treatment. So the other procedure that would cause something to be airborne is a bronchoscopy. And then respiratory, when they do different procedures, if it's a vented patient, there are things that could make the virus become aerosolized. Okay, but these are the two main things. So we should seriously, as nurses, question an order from a provider if the provider orders a neb treatment on your patient. Okay, so patient has suspected COVID, and maybe, whatever. I mean, I'm not bagging on providers at all. So they write a prescription for, or an order for a nebulizer treatment. Okay, but you need certain things in order to switch over to an airborne precaution patient. So now if you do a nebulizer treatment, it's going to become aerosolized, i.e. airborne, which means we need to question the order, okay, if the patient is not in a negative pressure room. So a negative pressure room, and there's usually only a couple negative pressure rooms on each unit. And so you have to be really careful. If you're not in a negative pressure room, whatever is in that room, per the ventilation system, is going to be pushed out to the rest of the ER. The other rooms, the nurse's station, everywhere in the ER, it could possibly, definitely be pushed out to the rest of unit and to the rest of the hospital. So we don't want to do that, okay? Negative pressure room keeps everything inside the room. So whatever's in there, all the nasty little bugs that are being expelled, that are airborne, buzzing around, those stay in the room. So if your patient is not in a negative pressure room and your provider orders a nebulizer treatment, you need to either figure out, do you really want this? Or if it's very, very, medically necessary, then you need to arrange to move them to a negative pressure room. But if you don't have a negative pressure room available, then you need to figure out, something. So either way, you can't do this unless the patient is in a negative pressure room and on airborne precautions. Okay, so let's talk about airborne precautions. So what do we wear? Well, all the droplet stuff, the stuff we were already wearing when we were doing droplet. But then we add our special thing, right? What do we add? Well, we add our N95 mask, okay? Or if you have never been fit tested for an N95, so fit testing is where they have you wear different sizes, either the duckbill one or the regular dome-shaped one, and then the person fit testing you has to be certified to do fit testing, and they waft through a little kind of like perfume squirty thingy all around your mask to see if you can smell the nasty odor that they're spewing at you. If you smell the nasty odor, guess what? You fail that fit test. So then they'll move you to a tighter mask, different size, different kind. They might move you to a small or take you to the duckbill small. However, if you're like me, for whatever reason, the only time I could pass an N95 fit test is when I was pregnant. I'm guessing because when I was pregnant, my face was chubbier. I don't know. And so I was able to wear a duckbill while pregnant. Now, for the rest of the time, ever since, I've failed every single fit test. I've had 3 separate fit tests in the last 4 years, and I've failed all of them. And so, forevermore now, I just say, I'm not doing any more fit tests because I know I'm going to fail it, so just give me a PAPR, okay? So the PAPR is the big, it's not too bad. It's the battery pack hood, right, mask. Hood covers your whole entire face, seals all the way around your head, and then has the big hose that attaches to the ventilator, or the respirator, I guess is the better term for it. And it is spewing positive pressure, okay? So that's why they call it positive airborne pressure respirator. There we go. Resuscitator. Okay, so, or the PAPR. All right, now the other thing that we want to make sure that they have, remember what we talked about down here, if your patient is not in this type of room, they cannot be on airborne precautions, okay? So this is where it gets a little sticky. If you have more than, 2 or 3, then you have reached capacity on your negative pressure rooms, okay? So we need to have a negative pressure room. Okay, now let's talk about examples of infectious diseases that need and require airborne precautions because they are transmitted via the airborne route. Meaning they're not on a droplet. I guess they could be on a droplet, but they are just floating around. They don't need a droplet. Okay, so these are the ones that are more common. Measles, that is airborne. Okay, not German measles. Regular old measles or rubeola is airborne, okay? And then chickenpox, of course, is airborne. We don't see a ton of this since the chickenpox vaccine, but every once in a while you might see one, okay? Another one that is airborne, not necessarily known, is called, it's a type of shingles, okay? It's a specific type of shingles. What? So regular old shingles only erupted in one spot on the body, or one dermatome. That is just contact precautions. So just gloves and a gown, right? However, if there is an outbreak of shingles in three different dermatomes, it has now become what is known as disseminated. disseminated shingles. So the definition of disseminated shingles is an outbreak in 3 separate dermatomes, okay? And shingles will attack unilaterally, okay? There will be a unilateral outbreak, not bilateral, in the same dermatome, okay? Then we have TB, and that's the common one that we deal with mostly in the hospital is TB, where you have a suspected TB patient and, you know, it takes a few days to get tests back, and so, you know, if they fit those qualification of symptoms, they're going straight to a negative pressure room. You wear the PAPR or the N95, okay? Kind of a guilty until proven otherwise situation, so that we don't have, so that our epidemiologists don't have to track down, you know, every single patient in the ER that was with that patient that day, and every healthcare worker that had contact with that patient. You can see how that would be really a big nightmare. The other one that we don't really see anymore is smallpox. We don't necessarily see that in this country. Okay, so those are the airborne, transmitted airborne infectious diseases. Okay, now let's talk about how to don our PPE, okay, our personal protective equipment, or PPE. So how do we put it on or don it, right? Just like in the Christmas Carol, right? Don we now our happy apparel, right? Okay, well, we're gonna don our Droplet apparel, okay? So this isn't airborne. We're gonna talk about donning our Droplet apparel, okay? Because that kind of pertains more to our scenario today. So donning our Droplet apparel, first thing starts with an H. What do we do first thing? For 20 seconds, okay? 20 seconds, we're gonna do hand hygiene. So HH, hand hygiene. Then we put on our gown, okay? Then we put on our mask. Now, since we're talking about mask, what color goes on the outside? What, does the white, does the blue? The blue goes on the outside, okay? If it's a color, it goes on the outside of the mask, the white touches you, okay? Then after that, we put on our eye protection. We put on our gloves. Now, in the video, or the simulation game, it's kind of cool because one of the nurses will go through the steps of putting on a mask. So first they do, you know, their ear loops, then they attach the nose, then you'll watch her and she'll pull it under her chin, okay? So ears, fit it to your nose, and then pull it around your chin. Okay, and she goes over that in the video and you can watch her do it. Now, we went into our room, we took care of our patient, we did all our patient care stuff, try to group it all at the same time so you don't have to come in and out and put on and off, right? Now we're going to come out of the room and we are going to doff our Droplet Precaution clothing, right? Okay, so now the first thing you take off are your, what do you think? First thing you're going to take off? What probably has more of the virus on it? Gloves, right? Gloves. So we're going to take our gloves off first. Then we do, because gloves are actually, our regular hospital gloves are actually slightly porous, right? So we have to do hand hygiene, okay? So we need to make sure that we do our hand hygiene. And this is our 20-second minimum again, right, just like before. Then after we do our gloves, hand hygiene, then we can remove our gown, right, okay? Then we do hand hygiene again, okay? And then what? So now we've taken off our gloves, did our hand hygiene for 20 seconds, took off our gown, did our hand hygiene for 20 seconds. Now we do take off our eye protection, or if we're wearing a mask that has the eye shield, then it all comes off at the same time. Take off our eye protection, then we take off our mask, then we hand hygiene again. Okay. Any questions? I will be pausing the video so that we can go through different questions that you might have had. Okay, thanks for watching.